This conference will now be recorded.
Okay. All right, folks. So I'm glad you're here today. So we are going to be finishing up this chapter, chapter 13, regarding nervous system. But then next class and next week, we'll be looking at the special senses. So looking at your sense of smell, your sense of vision, hearing, and such, right? So we'll continue on with the nervous system next week there. So here we go as far as central and peripheral nervous system. We talked about this last class, and we started off the class actually with looking at this. So realizing that the central nervous system is the brain and spinal cord, and you'll have here in these terms, and you're going to see the next image here that's going to review for you regarding afferent and efferent. You need to know the difference between the two, okay? You need to realize that afferent is bringing signals toward, efferent is taking signals or carrying messages away. Okay? Brain and spinal cord, remember, central nervous system. Everything else, the peripheral nervous system. Okay? And we'll use the abbreviations CNS and PNS. Okay, that's very common. You'll see here or there, as far as the peripheral nervous system is concerned, excuse me, so all the nerves that you think about when you think of the nervous system and such, all of the nerves throughout your body, that's the peripheral nervous system. So when you're looking at the nerves that are coming directly off of the spinal cord, spinal nerves, 31 pairs, you need to know that. As far as the cranial nerves coming directly off of the brain, 12 pairs. So again, they're bilateral, they're both sides, right and left. So we would say they're pairs. Somatic and autonomic, really what that entails and what's that going over is that somatic has to do primarily with what we're talking about as far as the skeletal muscle. And then autonomic, and we'll again revisit this today, is we're talking about as far as the sympathetic and the parasympathetic. So when we think of, and I didn't talk about this last class, is that when we talk about that fight or flight, preparing the body for action, write that down, that's a good one. Preparing the body for action, that would be the sympathetic division of the autonomic nervous system. Or we could say, this isn't correct in that as far as a title, but that it helps to explain it, the automatic nervous system, okay? So the proper term, autonomic, but really we could say it's the automatic because do you have control over this? You really don't, right? So the autonomic nervous system, or we could say the automatic nervous system, sympathetic division, fight or flight, that preparing the body for action. You're going to do something. You're going to run, you're going to fight something. Or how about like you're going for a job interview and sympathetic innervation steps in because you're just like, you're nervous and you're very concerned about the situation. You're just, my life depends upon me getting this job. And so like this kind of jacks you up and your body is kicking out cortisol, which we'll talk about with the endocrine system, as well as, it's the stress hormone, as well as epinephrine, also known as adrenaline, right? And so you're jacked, you're like, and you start sweating, your palms of your hands get kind of sweaty, you start sweating, you'll end up having a dry mouth. This is all sympathetic innervation. Parasympathetic, as you all are sitting there, whether you're online or whether you're in person here, things should be calm for you. Dr. Proden's not going around screaming, like, no, it's calm. Dr. Proden is just teaching you all about the nervous system and everything is chill. Your bodies are right now under parasympathetic innervation. Rest and, so you can say rest and digest. Rest and digest. These would be what's going on under parasympathetic innervation. I said to you that sympathetic prepares the body for action. Okay? Very good. All right, so the divisions of the nervous system. Important for you to know this, basics. Okay, and here we have this, and I think that I did show this to you last class. Just as a recap here, as far as that afferent and efferent. Afferent, bringing information, sensory input to the nervous system. Efferent, motor output away from the nervous system to a muscle, a gland, that kind of thing. Go ahead. Oh, okay. Yeah, so this would be right here. That's a cell body, a neuron cell body. I know, right? It just looks weird there and such. But yeah, so it's just, and there's actually an area where we're going to have multiple neuron cell bodies. It's called the dorsal DNRG, dorsal neural root ganglion, and you don't have to worry about it. But yeah, so that's what that represents. Although it does look like a leaf. You're right. Absolutely. All right. So this would represent, folks, spinal cord, a section, one half of the spinal cord right there. And those of you that are online, this right here. Okay. All right. Now the next image here just gives you a little bit more detail as far as what's going on with the nervous system and its breakdown and such. And so it's just nice to be able to look at that and see that and reinforce what we were just talking about. And this next image just shows you as far as the central nervous system and then the peripheral nervous. Yes, question. I will look. I'm not sure. Actually, I'll give you mine. I'm missing one page, but I'll make sure that you get it. Okay, you're welcome. Sure, no problem. All right. So this image right here that we're looking at right now just shows you as far as the presentation of the central nervous system and then what's extending off of the central nervous system as far as those 31 pairs of spinal nerves. You're just seeing a little bit of representation of the cranial nerves at the superior aspect of this image. And then you're just seeing also even the nerves that are exiting, branching off of the spinal nerves, like say the sciatic nerve, okay? And if anybody's ever had sciatica or sciatic nerve pain, right? Ooh, it's not a fun thing. Pain radiating down the buttocks and into the leg. That is not a happy situation at all. All right, so let's continue on with this review of the branches of the nervous system. And you'll see here as far as somatic and autonomic. Somatic, again, carry signals related to the movement of the head, trunk, and limbs. And so this is important for your skeletal muscle system to do what it does, right? Skeletal muscles contract, move the bones, move the body. Okay? Autonomic nerves, now this is, again, we could say the automatic division, not a proper term, but again, just descriptive wise, it's like, yeah, it makes sense. It's automatic, you're not controlling it. Somatic, you have voluntary control. Autonomic, you don't. So you'll see here that carries signals between internal organs and other structures, divided into that sympathetic and parasympathetic groups or divisions, and carrying exciting and inhibiting signals to the internal organs. And so this is important because think about this for a moment. I just said to you that if that sympathetic division is preparing the body for action, so would it make sense for when you're under stress, and say I remember watching on what was it, like National Geographic. There's a documentary, and it showed how this gentleman was a police officer, and he was in a mountain type area, right? And there were forest fires. So I'm trying to remember. Probably it was like California, right? And these forest fires, there was a fire that was advancing upon a group of people. It was moving very fast. Okay, it was really dry out. The fire is moving very fast. He pulls up in his car to the home where these people were at, and then all of a sudden there's like a crazy like wave of flame that starts coming at him. So he runs, and he's able to run at a crazy speed because he's an Olympic athlete? No, because that sympathetic division kicked in, and helped save his life. Yeah, remarkable. And the people that were in the home, they were in like a pool to protect them from the bad flames. I mean, it was just crazy stuff. I've never, I recall when I was in the service and I was stationed in California, you're driving on some of the major roads during the summertime, and there are actually just like little fires on the side of the road. And it's the craziest thing. You're like, there's fire, it's like, yeah, it's normal. Like it's kind of crazy. But really honestly, as far as fire is concerned, and so fire in a home or a business or something like that, or out in, like forest fire, so scary and dangerous, honestly. So sympathetic division. So during that episode, right, where this guy is would it make sense for his digestive system to be really receiving a lot of input at this point in time? Not at all, right? So that's why it comes to like parasympathetic. When your body is under more of that control, it chills you out, you're calm, and this is like the rest and digest. So your digestive system, your urinary system, that's all working primarily during that. So when you're calm in here, right, does it seem like you have to go use the restroom on a more regular basis than when you're actively doing a job or you're doing something? Yeah, not so much, because you're under more of a parasympathetic control. There's another term here. I'll give you another acronym for this, and it's SLUDD for parasympathetic, and that would be salivation, lacrimation, urination, digestion, and defecation. Yeah, okay. And my spelling can be off sometimes, I'm sorry. So you'll see here salivation, so production of saliva, so digestive processes. Lacrimation, so production of tears. Urination, we get that, filtering of blood to produce urine. Digestion, right? We just talked about that as far as processing food and such. And then defecation, actually, releasing food materials that we no longer need, right? Waste products. So that would be also under parasympathetic control, this calm state. Now, I'd like you to do something for me right now, and it would be a matter of just, everybody's just going to sit at their seat. You're going to put your hands on your abdomen. Put your hands on your abdomen. You're going to close your eyes. You're going to close your eyes, right? And you're going to do something called belly breathing, okay? Belly breathing is, right? I know, right? It's weird. All it is just a matter of that when you inhale, inhale and allow your abdomen to just kind of expand, right? It's really deep diaphragmatic breathing. So you're just doing, I know, right? Your diaphragm, that's just the muscle underneath of your lung, beneath your blood. So here's the deal. So I know it's, now you're gonna get me laughing. All right, so everybody close your eyes. And I want you to just go breathe in. When you breathe in, just don't do it shallow, do it really deep. Now, what's happening is that you're doing the opposite of what I asked you to do. Yeah. But doing this breathing so that your belly goes out and then goes in. And I want you to close your eyes and do this, right? And you do it, we're gonna do it for like a minute. I'm gonna time you, okay? I have my timer, all right. Parasympathetic control, there we go. So do the belly breathing. I'm not gonna talk for a minute. All right. Okay. So let's talk about what can go on with this. Can this be a tool that you could use when you're a little stressed out? It absolutely can, folks. It absolutely can. So if you're in a situation where you're sitting in a waiting room, right, and there's something going on that's going to happen, whether you're going for an interview or your boss is going to yell at you. No, they shouldn't yell at you, but just, like it's not any kind of a stressful situation, right? This is something that you can do, that you can elicit that parasympathetic response. And what's going on is that you're actually stretching cranial nerve number 10, the vagus nerve, by doing that type of deep breathing and such. So that's a way to calm you and such. So something to try at home when you're not laughing and such. I get it. No worries. Cranial nerve number 10, the vagus nerve. So that's a nerve that's coming directly off of your brain. And that cranial nerve number 10, do you recall I said this to you earlier last class? That cranial nerve number 10 is involved in really control of your internal organs of your thoracic and abdominal pelvic region. All the organs in there, they also receive innervation from, they receive electrical supply from that cranial nerve. So that, do you remember this, that I said to you that if you were a quadriplegic, but the cranial nerves are still intact, even though you couldn't walk, you could still have nerve flow going to the organs of your chest and your abdominal pelvic region. Go ahead, yes.
I saw in a video like doesn't matter which one, but you start to feel bad.
So if you're, say it again. But what's the circumstance that why you would do this again? If you're hungry. I have never heard that one. Now I've heard different things. Yeah, okay. So it might be though just a matter of that it gets you to focus on what you're doing right like that, and then you're not really focusing on then the fact that you might be hungry. Yeah. But here's the thing. People can also do stuff like where you'll go about 3 fingers in from your wrist, and if you're having an issue with feeling like motion sickness and such, and you can start massaging on the inner part of your wrist. They have little wristbands that you can wear that can also stimulate that area, and that can kind of help a little bit with that. Now here's the deal with motion sickness. If you are fully on like, oh, I'm not good, no matter how much you rub your wrist, you're supposed to really do that like before you come into a situation, like before I get on the boat, before I go on a ride, I'm wearing those wristbands and I'm trying to do what I can to help with that. Now, so let's go to the next slide here. Next slide. And so here you're just looking at a little bit more as far as the brain is divided into regions: hindbrain, midbrain, and forebrain. So we're going to go down from below first. The forebrain. The cerebrum processes information. And so what'll go on is that there are hemispheres, there are areas of the brain, and we're going to be in the lab, not this week, but next week, you're going to actually review like the different parts of the brain as far as these regions. And so we'll look at that, but primarily, folks, your frontal lobe, right? So everybody look at your forehead, right? Behind your forehead or deep within the that's the frontal lobe. And all of who you are, primarily, that's where it's at. Do you recall this, that, have you ever heard of lobotomy? Have you ever heard of that, a lobotomy? So where do you think they tried to damage the tissue of the brain? It was the frontal lobe, right? Mm-hmm. Frontal lobe. So that's your personality, who you are. And also having to do a lot with what goes on as far as how you think and your cognition, and also your ability to control your muscles. The voluntary control of muscles, the motor portion of your body, of your brain, that's that frontal lobe. Go ahead. Can they do it in the temple too? Not, I mean, well, I mean, they would do it through here as far as actually through where, in, like, interesting. Okay, yeah. So, yeah, indeed. I'm not sure. I always knew it as, that they would go more in the anterior portion of the skull and such, and through really the orbits and such. So, midbrain, yeah, it's terrible and it's sad because actually they did these to people that really were not really understanding fully what could happen to them as a result, and bad things, not good. Yeah. Midbrain. relays information from the sensory organs to the forebrain to the processing area, the cerebral hemispheres and such, and then the hindbrain. So here we're looking at the very, very important parts of the brain that will control major functions like your heart rate, respiratory rate, your ability to breathe, your blood pressure, your medulla oblongata. And oh, interesting. So you see here breathing rhythm, heartbeat strength. When people take cough medicine, over-the-counter cough medicine or prescription, where do you think a cough medicine is trying to act on your body in order for you to stop coughing? Nope, it's there at your medulla oblongata, which has one of the coughing centers. It's the coughing center of your brain. And so if I take too much cough medicine, would that be a good thing or a bad thing? And even though it's over the counter, you can buy it at the grocery store, at the drugstore, it's affecting the same area of your brain that affects what? Breathing and your heartbeat. That's pretty crazy stuff. There's people that will actually take cough medicine and mix it with vodka and such and alcohol. Yeah. Yeah. So here's the thing, right? So is this a very smart thing to do? Not a good thing to do. Not wise. I'll give you another one. People will take vodka and they'll put it on a tampon and do something like that. Or listen, they'll take vodka and they'll put it in the other area down below. Or they'll take vodka and they'll take like an eye cup and they'll put it on their eyes. All of these things, including the cough medicine, right? Not wise. I mean, you could do something 1, 2, 3, 5, 10 times and it not really be a major issue, but it just takes one time for it to be a problem and you end up at the hospital, right? So just trying to give a little bit of clarity and trying to make sure that you guys are okay, please, don't do that kind of stuff. The cerebellum, look at this, folks, here, the hindbrain, medulla oblongata, the cerebellum coordinates voluntary movements. So how about this, folks? So someone is inebriated, they're drinking, right? They're drunk, right? And they're walking, and the police officer will have them try and walk a little bit. Shh. The police officer have them walk, right? Why would they have them walk? Because when you drink and you get drunk, you can temporarily cause insult and damage to the cerebellum, which controls your ability to walk. So like, you might be like walking a little bit like kind of crazy. That's because of that. You're affecting the cerebellum.
Why people become like more aggressive? Like some people?
Yeah, well, and that's also part of like personality and such, because primarily, so here's the drill. When you're drinking, it's really a depressant. So it really is. Yeah, indeed. Yeah, because so right off the bat, it may not seem that that's the case, but it does, right? It really is more of a depressant than it is a stimulant. But again, just some people, what does it do though? It removes inhibition. So if it removes inhibition, then someone might be an angry person and it might not come out so much, but if they're under the influence, it'll come out more. Yeah. So here we go. This is going to talk about brain structure as far as coverings of the brain and areas where there are fluids flowing through the brain and covering the brain and such, and floating the brain actually. So here you go, as far as it says here, the brain is protected by 3 meninges. These coverings, these areas where there are layers of covering, membranes of connective tissue. We have this, you've all heard this term, cerebrospinal fluid, CSF, fills the spaces in the brain and the spinal cord, and actually helps to contribute to moving waste products when we sleep at night. So cerebrospinal fluid is very important. And so what happens is that while you're sleeping, and think about this for a moment, this will make sense to you. While you're sleeping, this cerebrospinal fluid will be able to go through the tissues in your brain and remove waste products, okay, of the brain working. So you're like, I don't understand that. Well, how about this? Say you stay up really late, 2, 3 o'clock in the morning, right? and you get up the next day at like 7 o'clock and you have to go to work or go to school.
Yeah.
How do you feel? Do you feel all like, hey, yeah, great?
No.
No, you don't, right? You feel like, you kind of feel a little like you're not right. Now, I'm not even saying that I'm not even saying that like you drank the night before and then you get up. No, I'm just saying even if you just stayed up late, did some things, went to bed 2 o'clock in the morning, 3 o'clock in the morning, woke up at 7 and had to get ready for work or school, you kind of feel like you're not right. And here's the reason. Why? Because you didn't get enough reparative type of sleep and allow for that cleaning of the waste products of you working in a day and just thinking. You ever get to the end of the day and you're kind of like, I'm not only just physically tired, but I'm mentally tired and I don't feel like talking about one more thing, right? Or studying or whatever, right? You're just like, oh, done. Yeah, this is because that your brain over a period of time is building up these waste products and you need to clear them. And there's a problem, there's a correlation, they're studying this, correlations between the buildup of these waste products and not getting them removed properly and also issues with dementia, which is scary. If you have ever known someone who is suffering from dementia, that is the last possible freaking thing that you would ever want to experience in your life. You do not want to have dementia. First, I'm gonna go here and then I'll go.
Yeah, as
Go
you
ahead.
said, I also read somewhere that like if we sleep really late and then wake up early, the brain didn't have time to like delete all the unnecessary information. So like that's why sometimes we feel past in the day before and we're not ready to start the new day. So that's why the day goes like you're not living that day, but in the past, just because the brain didn't have time to delete all the things that happened.
Okay,
That's not because
I've never heard it said that way,
Yeah.
but I can understand though that
it's more like
that-
psychological.
yes,
So-
understood. And I can understand from the point of view that again, like if you're not having enough of that repair work, right? That reparation, the reparative type of sleep and allowing for your brain to just be able to process. So do you recall if I've ever said this to you that you can actually study like a half hour before you go to sleep and go to sleep and your brain is still working on that information that you've been thinking about and studying before you go to sleep. And that's because your brain never really truly goes to sleep per se, right? Understand that, you know, they're still working, it's still functioning. But there is those different waves of sleep that you'll go through. But yeah, so and then I'll go, no.
Why
Mhm.
is it like 8 hours instead of 5?
Yeah, so here's the range. So the range is between 6 and 8. Okay, so when you go like towards more to the 6, you know, the reparative type of function of the body, not only just the brain, but all else body systems, doesn't seem to be as good. And your immune system is weakened when you don't get as much sleep.
He was just kind of like all over the place. You know what I'm saying?
Yeah.
Like he
Do.
didn't really know what law was and stuff
Oh.
like that.
So what goes on with dementia also, and I'm sad for you that, you know, because it's terrible. I have had family members also, and same thing. It's like when it started, that dementia, when that process started, that's pretty much when you lost your granddad, right? And same with us and other people that have had relatives that have experienced that, because that person is changing. They're not the same person until it's very sad.
But sometimes
Yep.
you used to think like where his mind would go, like you like
Yeah.
Max like when he was in his 20s and stuff.
Yes.
You know what I'm saying? So like
Yeah.
even before my mother was born and stuff like that. And
Yes. Yeah.
All up to my grandmother.
Yes.
She was in the nursing home.
Mm-hmm.
You know what I'm saying? So
Yes. Indeed, and it's really sad, yes, because what happens is that their short-term memory is shot, and their long-term memory is the one that they seem to be able to grasp at. And how about this also with dementia patients, that they'll even like music can bring back memories to them, right? How about us? Did you ever listen to a song and it brings back good or bad memories, or a smell that brings back good or bad memories, right? And that has to do with what's called the limbic system. This is your emotional brain, indeed. Yeah. So thank you for the. Yeah. So that's another form of dementia. So there are different types of dementia. Yeah. So like Robin Williams, he had a type of what's called Lewy body dementia. So there's different types of dementia, but they all are terrible because the people they're just losing their ability to think clearly, and they're just not the same person, and it's terrible. All right, you'll see here that with the blood-brain barrier, right? So it helps control which bloodborne substances can enter. So really, this is a protective mechanism so that, have you ever heard of meningitis, spinal meningitis, right? Have you ever heard? Meningitis is a very serious nervous system infection. This is not what you want. And so blood-brain barrier helps to protect you from that. But just like any other part of your immune system, it's not 100%, right? And so sometimes you may end up getting sick as a result of that interaction between someone who is experiencing that. All right, so let's move on. And we're going to show this next image here. You'll see here, this is a sagittal, a lateral view, side view of the nervous system and the central nervous system in particular. And what you're seeing here in the blue space will paint, this is what's called a ventricle, a space within the brain. And this will contain the fluid, that's cerebrospinal fluid, okay? There are multiple meninges. They're called the pia, the arachnoid, and the dura mater, okay? So there are multiple connective tissue layers to protect and to hold on to liquid and to really float, keep the brain protected, and really allow for a little bit of it to float within this fluid to allow for this protective mechanism for preventing damage to the brain. Let's look at this next image here, this next slide. And we're seeing here the cerebral cortex. So the cortex is the outer portion of the brain, those hemispheres that we were talking about before. Enables conscious thought, the ability for language and such. And so folks, I'm giving you like a very neurology light, like a very just like a little bit of information for you to learn and to understand. But I mean, the study of the nervous system and neurology is very intense and can be very challenging for sure. And there is so much to learn and to know. I'm just giving you a little bit of information to help just give you some understanding of how the nervous system works. And that's where we're going with this class. You'll see here that the cortex interacts with other brain regions to shape emotional responses and memories. There's a motor, sensory, and association areas. These association areas work in conjunction with and help the areas of your brain that have control over certain functions. So I'm getting a model out right at the moment here. And so what I'd like you to see with this is that this model of the brain, okay? So we're going to look at the side view here, all right? So this is the frontal lobe right here, parietal lobe right here, occipital lobe right here, and then temporal lobe, okay? Now, know that each of these regions has certain different functions that are important. Now, where it says here the motor area, that's in the frontal lobe. That's in here. And in particular, this area in particular is right here, the frontal lobe. It's a part of the frontal lobe that's in charge of the motor functions and motor control. Sensory would be right behind it in the parietal lobe, sensory. And so these two regions right here and right here allow for us to be able to receive information and then to process whatever specific process response that the brain would like to do, as well as far as for controlling of the skeletal muscles. And those association areas are surrounding area of nervous tissue that help the processes of motor function and sensory function. Go ahead.
Is there any way we can use 100% of our brain?
Yeah, see, so here's the thing, right? You use your brain. So you don't just use only 10% of your brain like they say.
Yeah,
That's-
I saw like
yeah.
the nurse saying that we don't use like the function of the brain.
So here's the thing. Are you using all of the areas, synapses, their connections in the brain at once? No, you're not. If you did, you'd have what? You'd have a seizure, right? Because what happens with a seizure? You have an electrical event and it just kind of short circuits you a little bit and you'll have like, you know, massive tensing and contraction of musculature. Yeah, that's, but all areas of your brain have different controls over different aspects of your body. So you do use all of your brain, just not all the time. You understand? And depending upon the need and the demand. Okay. I hope that makes sense to you a little bit more. Okay. All right. Yeah. So so how about this? Take your hand and put it behind your head and feel the back of your skull. Back of your skull. That's that occipital lobe. Occipital lobe. This right here, that's your cerebellum. That's what we talked about that for control of your. But there, right here, occipital lobe. That right there, folks. That occipital lobe, control of your vision. So very important for your vision and such, yes. So your visual cortex and such, right there.
Is that why they say I have an eye in the back of my head?
I have heard that. I think that's just, what would we say that is? Urban legend for mothers and fathers, especially mothers talking to their children. But anyway, but that's good. I don't know. Honestly, that would be very interesting though. But here is the thing that's interesting, right? Is that so if you're involved in fights, right, and you get hit in the head, okay, get hit in the face, right? What happens? Remember I said to you that the brain is floating in that cerebral spinal fluid? That fluid just floats a little bit. But what happens is that you get hit in the face, and actually it can affect and damage the posterior aspect of your brain. The back of your brain. Okay, so that's not a good thing. Go ahead. Yeah, so if it got damaged real bad, sure it could. Yeah, absolutely. Go ahead.
Like some years ago, I think it was 11. This part of my head.
Your temple.
For like 2 hours.
Your temple.
I was blind. I was blind.
Well, I mean, look at where your eyes are, and then the extent, then what connects your eyes to your brain is called the optic nerve. That's a cranial nerve, number 2. And so could that have caused some type of swelling or inflammation to that? Yeah, that's pretty scary. Indeed.
Because I woke up, was in the hospital, and
yeah, so temporarily you had some type of inflammation. Understood. Yeah. Yeah, so you had a traumatic brain injury, a TBI. So all right, so let's take a look at that right now. So let me just finish off with this one part of this slide. So the limbic system, I said, was your emotional brain. And so part of the limbic system would be for your memory, right? For memory as well as for your sense of smell. Emotional brain, that limbic system. Now let's take a look at what I handed out to you all, and I'm going to pull it up online for us here. And folks that are online, I'm going to share this with you all. I just have to find it. Here we go. Okay, here we go. Brain Injury Awareness Month. This is just a handout that was that I found online, but it gives us some good information regarding concussion and such. Okay, so these would be considered minor brain injuries, but understand that a concussion and multiple concussions can have a cumulative type of an effect. So it's not a good thing. So in other words, if you had a concussion and you get another concussion, another one after that, right? This can also lead to a more severe damage to your brain. So let's look at this for a moment here. So brain facts: returning to sports before a brain injury has healed completely can put you at risk for secondary, for impact syndrome. Okay, so yeah, so leading to, again, like I said, further complications of and damage to the brain. Let's see here. Many mild TBIs, traumatic brain injury, are not diagnosed until the person begins to have problems down the road, usually doing something that was once an easy task. Okay, and so this is like for a family physician to initially figure out, like, hey, there's more than what's going on that I can handle, and then referring you to a neurologist. Okay, so you'll see symptoms: headaches, dizziness, depression, anxiety and irritability, memory loss, insomnia, having trouble sleeping, sensitivity to light and noise, difficulty concentrating, right? These can all be issues going on with your brain, that your brain is talking to you and saying, hey, there's a problem here and you need to check this out. Just like pain, folks. Pain is the body's way to speak to you and say, hey, there's a problem here. Please go have it checked out, figure out what's going on. Let's see here. Also, so let's look at this here. So, yeah, nausea and vomiting, headache and neck pain, like you were saying. Yeah. Loss, what, pardon me?
I was out and vomited.
Yeah, yeah, it's crazy. Loss of eye movement, because, and so know this, right? That, so your ability to move your eyes, that's a voluntary muscle, skeletal muscle, but again, very closely related to what's going on with the brain and such, and that could be a problem. Dilated pupils. And so this is a problem also that we'll see that as a result of control from the brain, if your pupils are dilated and you haven't been smoking something that's not good, or taking medication or drinking or whatever, your pupils should not be dilated. But if someone has had a car accident and their pupils are dilated or non-responsive to light, that's a problem. That could be an issue. That could be an indicative factor of damage to the brain. Respiratory failure and coma. And you can look at these folks and just see, but there's just plenty of information here regarding this, and I think it's really important to be aware of. And so, you know, even for those that are younger, that are involved in sports and such, we as parents, guardians and such should be very much aware of what's going on with children and protecting them, you know, because we don't want them to have these multiple brain injuries that could really lead to problems down the road and such. Years ago, there was something called punch drunk. Have you ever heard that term used before, punch drunk? And so what goes on is that this was as a result of people who are involved in boxing who really just got hit way too many times and ended up developing brain damage. How about, so Muhammad Ali, right? We can understand this though. Muhammad Ali ended up having brain injury as a result of boxing and suffering with Parkinson's and all kinds of other issues going on with his nervous system. That was just very sad and terrible. All right, stand for a moment. We're not going to take a break. Just stand for a moment. If you need to take a break, go do that. But I want to be able to finish up this before we go on our break and then be able to come back for, so just stand and stretch it out if you want to. A few more slides and then we'll take our break and then we'll come back for lab. All right, very good. So I want you to see this next slide here. So it's showing you that the cerebral cortex, again, having this conscious thought and such, I want you to see that and to think about the next slide here. Consciousness and sleep. Okay. Again, it's kind of a weird thing in that. So think of people who have been put into an induced coma, or that as a result of, like, they have some type of been involved in some type of injury, and we'll put them in a medication-induced coma, or someone who actually just is in a coma as a result of some type of injury, and they've not been placed in it, but they're not responsive. That's pretty scary. We can all be sleeping, and some of us can sleep deeper, be in a deeper sleep than others, and it'd be a little bit harder to rouse someone, but you can still get them awake, right? Someone who's in a coma, they are unconscious and cannot respond, right? Yes. Because to kind of slow down processes of the body and allow for the healing to take place and the body to be able to focus on just healing. Yeah, so I'll tell you an example. So I had a cousin who had a massive heart attack, right? And it was really not a good thing. And they slowed his body down by also putting him in a very cold state, cooling down his body, as well as putting him in more of this coma, induced coma. And that was able to help the healing process, and he's okay today. I would think so. Yeah, I would think so, indeed, yeah. To help to maintain them, the levels and such of the medication to keep them in that state, yeah. So consciousness, you see a spectrum of brain stages from alert to sleep and coma, right? And we talked, so I just mentioned to you about coma, and it depends upon this reticular information, this area aspect of the brain that focuses on that. You'll see here that with sleep, you'll have different types. You've probably all heard the term REM sleep, rapid eye movement, right? And this is where dreaming occurs, more difficult to awake from the REM sleep, but you might have been awoken as a result of, so whether like you heard like a thunder crash and like, whoa, or you hear something crazy going on. I can remember, in raising kids and such, one of the kids will come in the room. This happened twice to us. Come in the room. I don't feel good. They wake you up. You're at the bottom of the bed. I don't feel good. And then, bleh. I'm like, what? Not only did you just do that, but you did that when you woke me up, and I'm like half awake. Like, yes, that's interesting. So, but like when you wake up from like a REM type state, do you remember what's going on as far as what you were dreaming? You'll do that. You're like, whoa, that was like a crazy dream, whether it was good or bad or nightmare type situation. But yeah, it's pretty wild. Go ahead, please. Yeah. So I think that's also the ability for your brain sometimes to, because like sometimes you'll have dreams that are just like awful. They're not so good, right? And I'm like, yeah. And so like your body's protective mechanism for you, like, why? Because really it's imagination, and even, how about this? Have you ever experienced a very stressful day? Really, and bad things went on. For whatever that could be, bad things happen. And you go to bed and man, your night isn't so cool. Your night's like where you're like having bad dreams and just like restless and this and that. Yeah, that's your brain is still trying to process what the crap just happened today and why, that kind of thing. In the back first, please. What's your first name again? Go ahead, please.
Second semester, so like February, January, February.
Mm-hmm.
I started working a job down there in Woodbridge. I was working home, but there was a lot of stuff going on, house and stuff.
Mm.
Like what I used to get off work at 12, get home, sleep. It was just a lot. I used to have fun.
Right. So that's a good point. That just like even just the fact that like what can contribute to insomnia, the lack of the ability to be able to go to sleep, is that you've got so many things happening and disturbing and just like crazy and just like busy, and it just kind of gets your brain is like trying to figure things out, and it's not allowing you to just be calm and go to sleep. Very calm. Okay. Well, I'm here teaching you now, so no. I understand. No, that's more of my nightmare. No, I'm only kidding. No, I mean, so yeah, here's what I would tell you. Here's what I tell you with that, right? Is that your brain is always working towards the goals that you want, even when you're not thinking about them. How about that? So like, in other words, like you're saying, I want to go. So I'm just gonna say, I want to go to nursing school, and you're thinking about nursing school, and you want to go to nursing school, and like even when you're not consciously thinking about nursing school, your brain is kind of working you in a direction so that you're going to be successful and be able to go to nursing school. So trying to achieve your goals for you.
Yeah, but there was a time I had a dream about like a guy from my town. He died.
Yeah.
My dreams. And the next day, he died. Oh my God. In an accident, like a motorcycle accident.
Yeah, understood.
So it was just
Yeah.
weird.
Yeah, so there is these different types of stuff that go on that. Yeah, I would tell you I don't put a whole lot of input into that. Okay, there are weird things that go on in our world that we don't have answers for. That I can tell you. Hey, there's just some times when you're like, man, that's weird, and I don't know. Yeah, seriously. Yeah. It probably means that you'll die within the next week. No, I'm only kidding. No. I'm sorry. No. So, but there. So, no, I'm sorry. so I have had a type of dream where you have like a repeat on that dream more than just once, or a continuation on it. And again too, your brain is always, it's still processing information even when you don't think you're processing that information. And yeah, it's just kind of weird. It is. And do we understand it really? So here's the other thing, right? So neurosurgeons, those that are working on that are surgeons that will operate on the brain, right? And the spinal cord and such. These are like the rock stars in the medical field because they're super brilliant, because it's really intense to have an understanding of what goes on with the human brain and the nervous system and such. And so they know a lot. And even as they know a lot, there's still things that we don't really truly understand about why the brain does what it does and how it does what it does. Think about this for a moment. Your brain is this soft tissue, right? It's this soft tissue that really, honestly, if we could open up your skull, we could take a spoon and scoop out your material. I know it's gross, right? But I'm telling you that it's soft. It's really soft. And so, yeah, take out, yeah, all the bad thoughts, take them out. And so here's the deal. Know that, right? It's a bunch of electrical activity and these cells, and this is like part of like, how is this, explain to me how it is that that's my consciousness and that gelatinous type substance called my brain. All right, so like, I've been studying this for years and I've been teaching it and doctor for all these years and worked on, and really honestly as a chiropractor, worked on people's nervous system with their spinal cord as far as the spinal nerves, those nerves that are coming off of the spine. And like, how does that really make sense though? It's weird, man. Come on, it's weird. It's very strange, but this is just how it is. And so, that's there are things that we understand and there are things that we just don't understand truly about what goes on with the body and in particular with the nervous system, brain. Yes, because really know this also, that with like treatment of mental illness treatment and trying to work as far as in the psychiatry and psychology is extremely challenging, folks. Extremely challenging. And are there any cures for mental illness? There's working with them and doing different therapies and doing different things in order to help manage what goes on. But is it really a cure? We would say it's not a cure. Indeed, yes.
I'm just curious about like animals that eat like.
Yeah. So let me tell you. So let me give you a little bit.
Like,
Yeah. So let me give you some input. So there's something called Kuru. There's Creutzfeldt-Jakob, CJVD, and these are. Did you ever hear of mad cow disease? These are all situations where animals, livestock, and then humans can ingest neurological tissue, brain, spinal cord, that kind of thing. And if it's infected with certain bacterium and such, right, and viruses and such, this can be devastating to the person. Or have you ever heard of chronic wasting disease in like deer and elk and such? Folks, this is like major neurological stuff because and it leads to death, and it's very bad in that by ingesting those types of things. So like cows, should cows be eating meat? No, not at all, man, right? But this is what happens when you start giving them things that they shouldn't be eating, and that's what led to like the whole mad cow disease. So I don't want to get off too much on topic because we I want to just let's see here as far as so memory. Let's go through last few slides. So memory, short-term and long-term. We get this, right? You all do all that you can while you're in school to strengthen your long-term memory so that you memorize and learn information that you need for your tests and also for your upcoming professions that you're going to be pursuing and such. So the ability to transfer from the short-term to the long-term, repetition is key. I think I've said that to you many times. Repetition is key. So being able to, you can't just sit there and cram information the day before a quiz or a test and think that you'll do well. Okay. Now, maybe it's just a little bit of information, not a big deal. But when it's a lot of information, you just overwhelm your brain and you'll get it. It'll stay in your short term for a very short period of time and gone. So, and there are different types of memory as far as declarative and skilled type memories. And so depending upon what it is that you're going to be doing, whether you're doing like a certain task or you're at an assembly line and you're doing the same job throughout the day, putting together something, or how about you're playing the piano or shooting hoops or playing hockey or baseball or whatever it may be, right? These are different types of memory that you'll incorporate, not only just the nervous system, but also the other parts of the body as far as your muscles and such. Amnesia, and so this is something that's very devastating, is for people who, as a result of some type of injury, have lost memory. Sometimes they can recoup, sometimes not. Look at this next slide here. And we're seeing as far as, all right, so sensory stimuli, as from the nose, eyes, and ears, and what's taking place with information that you're taking in. And this is just showing you as far as that, yeah, the short-term memory can hold groups of information for a short period of time, but then to actually transfer it to the long-term memory is a task and a process. And the more senses that you incorporate when you're trying to study and put something into the long-term memory, like, so here, listen to this. So read information, you hear the information. So you can, when you're at home, you can actually read information out loud to yourself. And so this way you're incorporating the ability to see, you're incorporating your ability to hear. You can also take notes and write down information, right? So there's multiple senses that you can bring into the equation as far as for trying to learn something. Very important. Go ahead. Yes, understood. Right, right. And so that's something that you have to figure out for yourself to try and, or you can get tested, and I'm sure that they could probably help give a little bit of insight, but really so here's what we recommend, that you just try and do many different things. So should you be doing flashcards for terminology that you don't know for a class? Yeah, that would be a good idea. So you could actually create the flashcards as well as learn and practice with them. Yeah, you know, I mean, I think here's the thing, we're all unique. So truly, we're all unique. And so we have genetically, as well as, you know, environmentally, we've been exposed to things that can help or hinder how we learn, right? If you had someone in your family tell you you're no good, you're stupid, do you think that ever contributes to anything good? Yeah, exactly, right? But sadly, people experience this, right? So that's an environmental factor of that contributes to genetically who they are. It's sad, you know, it's very sad. It's not, to me, I have to tell you, that's evil. Okay. All right, let's move on. I want to finish these last two slides. Look at this here. We've talked about different types of pathology and diseases and such. So concussion, so this is more of that traumatic brain injury, right? So this is kind of what we would consider it more of a mild type injury. So when you're looking at this sheet right here, as far as the brain injury awareness, right? So mentioned a little bit about that. Paralysis, we've talked about that already. Oops. There we go. Sorry. Paralysis, we've talked about. Parkinson's. So this is where there's issues with parts of the brain are dying off and not producing chemicals that they should, and so they're just not working right. And so someone who suffers from Parkinson's disease can have tremors, but not everybody that has a tremor has Parkinson's disease, because there are benign type tremors that can occur. But tremor, have you ever seen someone do something like this? That's a tremor, right? An example of. Also, they can have more of a blank affect to their face. So in other words, instead of like, you know, I'm Mr. Smiley, no, I'm not, but you know, smiling and such, somebody like that would just be like, just very like no real expression, and that can be as a result of this mask of just of expressionlessness from Parkinson's. But it's more than that. We're just giving you a little bit of information here right now. Alzheimer's. So again, this is another type of dementia type disorder, and again, degeneration is taking place within the nerves of the brain, the neurons of the brain. folks, in the beginning of this chapter, we talked about multiple sclerosis and we talked about Guillain-Barré. We said multiple sclerosis affects the central nervous system. Guillain-Barré affects the peripheral nervous system, and Guillain-Barré you can recuperate from. Multiple sclerosis, you know, that's a chronic illness, right? Autoimmune, your body's attacking itself. Different types of cancers that will affect the supportive cells, the glial cells. You have here meningitis, encephalitis. These are infections present within the brain and are the coverings of the brain. Very serious and can lead to death. Here we go as far as looking at headaches, and know that if you experience headaches, I feel for you. It's tough stuff. Yeah, it's hard. That is hard because you know what? Headaches are a very difficult illness and pathology to really help the patient live a life that's going to be symptom free, right? So it's really management and trying to go to the source of what's going on, the etiology, but sometimes we can't figure that out. And some of those medications are really strong and really have a lot of had a lot of side effects as a result of taking the medications to help with those. But yeah, so if you experience migraine headaches in particular, but many type of headache, very, very tough to deal with. Here you're seeing as far as affecting mood, neural disorders in the nervous system affecting mood. So ADHD, mood disorders like bipolar, depression, autism, schizophrenia, right? Bipolar disorder, right? All these different types of illnesses that can affect and insult the nervous system and really affect your ability to live life, honestly, right? If untreated, right, this can lead to problems that can affect you down the road and that can affect all your relationships. Honestly, folks that do not get treated, that have many of these issues that I have on the board here right now with these this slide, can lead to a further alienation of them from family and friends to the point where they become wards of the state. It's very sad stuff. Yeah. Our prison system, unfortunately, has many that have many of these disorders and such. And so instead of treating people, we're warehousing people. And it's sad. It's very, very sad. Now, as far as this last slide here, regarding EEGs, PET scans, functional MRIs, brain banks and such. So this is all a matter of diagnosing what goes on with patients and trying to determine what's going on with the function of the brain. And then also for studies as far as the brain banks, normal and abnormal brains are kept after death for a study and such. And so how about folks that are involved in like contact sports, like football, like wrestling and such, and different things where they end up having many times multiple traumas. And so trying to determine, well, how can we best protect these people that are in these sports and such, and protect our young people, right? So just the fact that like football helmets, the technology for them has changed so much over the years, trying to protect these young people and older, you know, as they're playing in professional sports also. All right, folks. So I hope that this was an interesting chapter for you all. Very fascinating. Again, too, this is a class for non-science majors, so it's really just giving you a little bit of like a run through as far as with this information. But as you saw with even just our discussion here in class, fascinating stuff regarding, I'm trying to understand a little bit regarding the nervous system. All right, folks, please take a break and I'll have you come back in 15 minutes.